Health information technology is absolutely essential. I mean, when Congresswoman Velasquez a moment ago talked about how much more expensive it is here than abroad, including on those numbers is the fact that we have the dubious distinction of having the highest administrative cost on a per capita basis of any of those industrialized countries. It's 7.3% of all the health care dollars go there. So health information technology becomes potentially a critical way to reduce those costs. Now, more explicitly to your question about how do you pay for this, we believe, pardon me, that an essential towards paying for all of this is a dramatic expansion of the primary care base in this country. The data from the United States, from Barbara Starfield at Hopkins or the Dartmouth Atlas folks, are absolutely compelling. And the study that we did, comparing us to 12 countries overseas in their healthcare systems, just equally as compelling. As you expand the primary case base, you see a reduction in cost as well as an increase in quality. And I would just leave you with one study that I think reflects this, and I might add parenthetically, and I know it's in your data. We just published an annotated version of 100 studies in the United States which make this point. But the one that comes to mind is one that's often cited from the American Journal of Medicine just a couple of months ago. A fellow named Kravitz was the lead author. And they concluded that if you had a community of 775,000, about 750,000, and they had about 35% of the physicians there were primary care physicians. In the country now it's about 30%. Overseas, it's 50%, the ones that do it so much less expensively and better. But if you could just increase this community from 35% of its workforce to 40%, pardon me, what you saw was a reduction of about 1,500 hospitalizations per year for a savings of $23 million per year. You saw 2,500 fewer visits to the emergency room. You saw 1,500 fewer surgeries by simply increasing primary care from 35% of your workforce to 40%. We believe that expanding health care coverage in this country and expanding the base of primary care physicians are absolutely inseparable.
And we'll come to you, and I would agree with that, but I'm trying to figure out how we get, when it comes to IT, because I'm worried about these small hospitals and how we're going to get there. I think it's important, particularly in the rural areas, to bring technology because it adds some resources that we don't necessarily have. I just don't know how we're going to get there and how we're going to pay for it in an environment where it's increasingly the costs are going up all the time. Dr. Heyman?
I have some personal experience with this. I've had an EMR in my office and used no paper since 2001. The EMR that I purchased is the same one now as I did before. It's a lot more robust now than it was when I purchased it in 2001. But there's no question that in my practice, it definitely saves money. It definitely makes me more efficient. It definitely prevents mistakes. And it's very, very effective. Now, for the very first time, we kept hearing about how the federal government wanted to have more IT, but for the first time, there's actually some money here, and that's very important. The other thing I would say is that there are a lot of barriers to this. In my community, we're very fortunate because we had a grant where every physician in my community now, actually, over the last 3 years, has actually been able to have their own EMR in their office, and we're supposed to be starting a health information exchange. Now, one of the barriers is that the standards are not there, and we have 6 different EMR vendors in our community. The physicians are supporting this health information exchange. All of these are CCHIT certified vendors, which means that they're supposed to be able to talk to each other, and yet in each and every case we have to come up with some sort of way of making them talk to each other, and it's very expensive, and we're not sure how we're going to be able to make that exist in the future. I would also point out to you that physicians are always the first people to accept new technology. They're the first people to use cell phones. They're the first people to use robotics in their practices. There are all kinds of technologies that physicians have used. There has to be a reason why physicians have not adopted this technology. And the last thing I would say is that when physicians are incorporating this into their practices, we found in our community that in spite of the fact that it was free, they got the hardware and the software for nothing, it was still very costly for those who were changing workflows in their practice to be able to incorporate this stuff into their practice. So we definitely support the idea of increasing health information technology. We think it's inevitable in medicine. But there are barriers. We need those standards done by the end of this year. And we think that it really will improve health care in this country if we do this.
No, I thank you all, and I think it'll improve it too, but we still haven't figured out how to answer the question. The money is there, at least a little bit of it at the moment, but still, how do we pay for it is the question that I have. If it's a result of savings, it would be good. But I just encourage you all to think about that. We've got to figure out how to pay for this. Thank you, Madam.